last speaker of the session, who will be delivering her keynote address as the award winner for the best paper presented in the Ocular Pathology Oncology Tumor session for 2023, Dr. Seema Das.
Thank you, Akshay. Can I have the slides, please? Slides.
Can we have someone from audio visual help her, please?
Thank you, Akshay. So I'll be presenting the results of the study on the factors impacting the time to diagnosis in a cohort of newly diagnosed patients of retinoblastoma. This was the early analysis, interim analysis from the INPOC RB01 study. RB we know is the highest cure rate of all malignancies. However, in our kind of part of the world, we do see a lot of patients with advanced disease with high mortality, mainly because of the advanced stage of presentation, and a delayed time to diagnosis seems to be the major reason for advanced presentation. Time to diagnosis can be divided into parent's lag time, means the symptom onset till the first healthcare consult, the healthcare lag time or the diagnosis lag time from the first consult to the diagnosis, and the treatment lag time from the diagnosis till the initiation of the treatment. So INPOC RB1901 is a prospective multi-centric collaborative study which was aimed at assessing the epidemiological clinical features of RB in India following a prospective protocol. And there are primary and secondary objectives of the study. I'll be presenting the outcome of the secondary objective to understand the reason for delayed diagnosis leading to advanced stage of presentation in India. Rest of the study outcome is still underway for the primary objective. So all centers treating RB in India were approached to participate in this study. A standardized prospective collaborative protocol for treatment as well as follow-up was shared with the study, and epidemiological, clinical as well as the outcome data were collected. So these are the distribution of all the 20 centers which enroll patients. The study has currently stopped enrolling, and the total number enrolled has been 1120 patients. The demographic profile has been what has been reported at par with what has been reported in the global retinoblastoma outcome study, with a major chunk of the patients being unilateral and a mean age of diagnosis 2.5 years. As expected, leukocoria was the most common presenting symptom in more than 80% of the patients, and this was the stage breakup of the patient. Half of the patient presented at a stage where the eye could be salvaged, that means they were stage 0, but more than 50% of the patient presented at a stage where eye could not be salvaged. But what was also marked was that more than 20%, 23% of the patient presented at stage 3 and stage 4 disease, means at presentation they were extraocular disease or metastatic disease. When we divided the distribution of all the patients in this study across the map of the country, this is the distribution of patients across all the stages, and we see an almost uniform distribution across all the corners of the country. But when you zero it down to only to stage 3 and stage 4 patient, there is a strike difference in the north and south. So there seems to be more of advanced disease in the northern part of the country, which is also has been found in the previous other studies also, and it corroborates the finding from those previous studies. Almost 36% of the patient had to travel more than 500 kilometers to avail the treatment. This was again a striking finding from the study. And when we look at the main outcome, that is the lag time for diagnosis, these are the parameters, the parental diagnosis as the treatment lag time. Mean lag time before the treatment could be initiated after the symptom onset was 4.2 months. However, the major chunk of the lag time was on the part of the parental lag time, 44%. That means at diagnosis, when the symptom onset was noted by the parents, before they took the first consult, almost half of them took it at a delayed stage. Almost 67% of the patients were diagnosed after 1 month of symptom onset. And what was also interesting was that who was the first consult for the diagnosis? Was it an ophthalmologist or a pediatrician or a non-specialist, which includes general physician as well as the traditional medicine practitioners? That also actually made a difference in the diagnosis. And majorly when the ophthalmologist was the first consult, almost 60% got the diagnosis at the first visit. However, when the non-specialist was the first consult, the diagnosis was made on the first consult in almost just about 12% of the cases. So almost 85% of the non-specialists missed the diagnosis on the first consult. We did a multivariate logistic regression to find out the factors which could predict the increased lag time at all the levels, parental level, diagnosis level, as well as the treatment level. And if we see the parental lag time, the most important factors which were significant were the mother's education or the literacy level. The socioeconomic status, of course, was there in important in all the lag times. The distance travel made a difference in the initial, the parental lag time was more if the distance traveled was more. If there was a family history of cancer, again, surprisingly, the parental lag time was more, which ideally should be less, but probably is the fear associated with the diagnosis and the associated treatment made them sort of, delay the consult. Age at pregnancy, if it was less than 20 years of the mother, again, the parental lag time was more. And also, if the consult was a non-specialist, the lag time was more. If we see the diagnosis lag time, mainly is the socioeconomic status as well as the first consult with the medical practitioner that made a difference. And as far as the treatment lag time was concerned, if the leukocoria was the first symptom versus if the non-leukocoria was the first symptom, the treatment lag time was more, again because many of this patient probably was atypical presentation. Bilateral disease as a high treatment lag time, maybe this treatment needs more complex management, including chemotherapy and other modalities, which might not be available at a secondary center level, where sometimes enucleation is done. And if the non-specialist was a consult, then the treatment lag time was more. So this was the main conclusion. The treatment lag time seems to be more at the parental level. Almost 24% had extraocular disease at presentation. And what is the extrapolation formula for this study is that we should make effort for earlier diagnosis if we have to improve the outcome of RB in India. And it should be directed towards community awareness, including advocacy initiative and as well as training and awareness of the healthcare providers. Since majority of this patient, even with a low lag time, little less lag time, also had stage group E disease at presentation, whether a more aggressive disease biology plays a role, that needs to be studied further. Thank you. These are the acknowledgements and these are the participating centers of this study.
Thank you, Dr.